Mr. Abdullah, how are you?
Hi, good. How about you?
Doing very well. Good to see you. So, Mr.
Thank
Abdullah is the Director of e-Services and Channel Development at the Information and E-Government Authority in the Kingdom of Bahrain. So, welcome on board. And we would like to start by asking you to give us a very quick brief about what you do, where you work, and the role of and your role in Bahrain.
Thank you, Mr. Ahmed. Thank you for having me. So, as you mentioned, I work in the Information E-Government Authority in the Kingdom of Bahrain. And simply put, the role of the Information E-Government Authority is actually to help digitize the services of the government of Bahrain to be able to provide them in an electronic manner, in addition to enhancing the processes, the government processes when it comes to giving the services out to the citizens and residents of Bahrain. We also work as a digital enabler for the different entities in the government. And we look at many other areas that involve under the digitization strategy of the Kingdom of Bahrain.
Great, thank you very much. Let us delve into the topic, and in particular regarding COVID-19 and the pandemic and how it really changed our lives. We're pretty much interested to know how using AI has helped the Kingdom of Bahrain in combating COVID-19.
Yeah. Well, we started off with the pandemic when it started in Bahrain, started off with forming a task force, a special task force that actually helped in trying to take the decisions necessary to combat the pandemic. And, being the digital arm for the government of Bahrain, we were tasked with the development of a mobile application, a smartphone application that would help the efforts, the medical team's efforts in combating the pandemic. So to put it simply, we have developed a mobile application called Be Aware Bahrain. It's available for Android and iOS phones. And through that application, we were able to provide numerous services. So it was like a one-stop shop for all services related to COVID, be it vaccination services, appointment services, result tests, test results, also contact tracing capabilities, and many other services. Now, in order, to maximize on the benefits of technology, we actually implemented AI components and machine learning components within the application and within the supporting systems around it. So what we did in Bahrain around AI to help us combat the pandemic is actually we employed AI to help us automate the contact tracing process, which actually have proven very essential and crucial to actually limit the spread of the virus. So as you know, the contact tracing mechanism started off with asking positive cases, where have you been, who have you been in contact with? But as you know, there were some cases where the contact have been there, the close contact proximity, but maybe you don't know who the person is. So you don't know who that, that actual person, their details, their contact details, etc. So what we did is we built an AI component that could, based on certain conditions that the medical team have put forward, with regards to the proximity level, with regards to the time spent together between the two people, and using AI and machine learning, we were able to preemptively inform the people that they might have been in contact with a positive case. And then we have, asked them to actually go and seek to do the PCR testing. So this is one area that helped us in terms of AI. Another thing is we actually help the medical team to flag positive cases proactively based on the isolation, based on the symptoms that they have reported during their home isolation. As you know, the medical team, medical staff all around the world have been strained to the limits when it came to the pandemic and the need for medical attention. So what we try to do here is to try to predict based on the symptoms that have been reported by people in home isolation. So we were able to kind of predict and flag and raise the red flag on the cases that have reported certain symptoms, again, based on the medical team and the conditions that they have provided us with. And we help them actually to focus on these cases in order to try and save lives, because, you know, time was of the essence at that time to actually help people and try and prioritize cases. So this is another area that we use AI and machine learning. The third area, which I wanted to mention here, is we used AI to actually identify location-based hotspots in the countries where the medical team was able to mobilize mobile testing units, mobile testing stations. We actually had, in Bahrain, we had these long buses, public transport buses. They were transported to testing stations. So these were moved based on the analysis of the infection data that we had, based on the location of the people who were infected. And we were able to predict that there might be an outburst in certain areas. So we were able to mobilize these stations and actually do more, let's say, proactive testing in that area. So at least we could actually predict a potential outbreak. So these were some of the areas that we used AI for that you know, helped us actually combat the pandemic.
Thank you very much. This is very interesting how you deployed and used the benefits of AI and predictive modeling to change or steer the direction in the right way. I can't stop helping my thoughts not to drift in the patient privacy area. So how did you manage throughout this use of AI to protect and to maintain privacy and cybersecurity for your patients?
Yeah. So what we did, you know, since the beginning of launching the application, we made sure that we use encryption techniques all the way from the data being transferred back and forth between the device and the servers. But the main thing here, what we did is, using AI and machine learning, we were able to restrict the access of any human being from the team, from the systems, that all the patient's data or all the people's data, when it comes to for the contact tracing, number one is strictly dealt with in a machine learning platform and an AI component platform. So it is like a black box kind of thing, so that anyone, any human being cannot actually look at these data. The second thing is, as I mentioned, we used encryption techniques between the data, like for the data between the device and the backend, the systems. The third thing is we use login. Basically, we ask the users to log in before actually viewing any results or any information. The fourth thing is we have a strict policy where we automatically delete and wipe out all the data after 2 weeks. So any data that is older than 2 weeks, it gets automatically wiped, and after it gets used for just for the contact tracing. The fourth thing is we again used AI to ensure that whoever is positive and in self-isolation is actually following the guidelines and not exiting their homes unnecessarily, using AI without, again, any human intervention. So what we try to do here is, try and use AI as much as possible to actually ensure that whatever information is collected. Number one is actually matched using AI and machine learning to identify contacts. Number two, that there is no access from any human being to actually that data. So these are some of the areas where we address the privacy. And the last thing maybe that we have always been advocating is that the usage of this contact tracing functionality is completely voluntary, and it can be switched off from the app. And whatever data that is available on the app, it's available after logging into the app. So we try to do that in that manner.
Perfect. Thank you very much, Mr. Abdullah. We'll move to the other panelists, and we'll see you again around the questions and answers. Have a great day.
Thank you so much, and good luck.